So today we'll be talking about the adrenal gland cortex, where and what the adrenal gland does. The adrenal gland is three lobes that are on the outside of the adrenal medulla, and each of these three zones both secrete a specific hormone. One of them secretes cortisol, which controls the body's macros and also controls the sleep-wake cycle. Aldosterone, which is a hormone that regulates blood pressure and electrolytes in the bloodstream, and epinephrine, adrenaline, and then norepinephrine, which is the main hormones which control your fight or flight response. What effects do these hormones have on the body, and why are they important? Hormones like cortisol and adrenaline are some of the most important hormones in the body. You use them every day, and also in a life or death situation. Increased cortisol levels are not necessarily good because it's also known as a stress hormone, which can lead to lack of sleep or even weight gain. The importance of these hormones is undoubted, and why they are important is because if you are in a life or death situation, adrenaline kicks in and gets you out of that situation. Feedback mechanisms and antagonistic hormones. For the adrenaline gland to produce cortisol, which is one of its feedback mechanisms, this like synthesis occurs. The hypothalamus produces corticotropin releasing hormone CRH that stimulates the pituitary gland to secrete ACTH, and then ACTH then stimulates the adrenal glands to make the release of cortisol hormone into the blood. And glycogen and insulin are antagonistic hormones to this because glycogen promotes the release of glucose in the bloodstream from stored glycogen by a process called signal transduction. What happens if the gland doesn't work properly? If you have a hyperactive adrenal gland, which can cause Cushing syndrome, which is a result in excessive production of cortisol from the adrenal glands. This symptoms can include weight gain, fatty deposits, especially around the neck, which is called the humpback, and the mother limbs actually become thinner. This can either be caused by taking prolonged steroid use or by a benign tumor causing the pituitary gland to produce too much ACTH. And if you have an underperforming adrenal gland, it's a hypo. So then you have adrenal insufficiency, which is a rare disorder, but can be acquired or can be caused by long-term adrenal insufficiencies is caused by a disease in the hypothalamus or the pituitary gland, and is opposite of Cushing's syndrome, characterized by low levels of adrenal hormones. What can be done to correct these issues? For adrenal insufficiency, a treatment involves medication, which is hormone replacement therapy. For Cushing syndrome, there are multiple ways to treat Cushing syndrome, but they depend on the case, and your physician will decide what action is best. There is reducing steroid use. If there is a cause of Cushing syndrome, which is a tumor, the doctor may recommend complete surgery. If surgery isn't for you or you aren't a candidate, they have radiation therapy to get rid of that tumor. And also, doctors may, if none of those options work, they may use a drug therapy, which will minimize surgical risk or get rid of this completely. Squares.